Hi, this is Dr. Matt Lawless from Knee Fit in 5 and MSM Products, bringing you another knee moment. Now we have Betty from Indiana. She writes in and asks, what different injuries can lead to knee arthritis? So knee arthritis that comes from an injury is really called post-traumatic arthritis. What injuries cause post-traumatic arthritis? Probably an ACL tear would be the most common type of injury that would lead to knee arthritis. What happens with an ACL tear is, this is our knee, we take the kneecap out of the way and look at your knee. The ACL is this structure that runs from the front here to the back, and it's responsible for rotational stability of your knee. So once you tear your ACL, some people have lack of rotational control. Some people are what we call adapters. No matter if they tear their ACL or not, their muscles function and keep their knee stable. Some people non-adapters, and we're not sure exactly what percentage that is, but it may be up to 2/3 or more of people with an ACL tear. Non-adapters have rotational instability, meaning if they twist or something because their ACL is not there, their knee goes like that. Knees are designed to go like this, not like this. So when they go like this, then they end up tearing the meniscus and potentially damaging the cartilage and having that potentially lead to knee arthritis. It usually takes many years, probably at least 7 to 10 years for an ACL tear to start causing knee arthritis. Half the people with an ACL tear also have a meniscus tear at the initial presentation, and that puts them at a little higher risk for developing knee arthritis, again in that 7 to 10 year time frame. The other type of injury that would lead to an early arthritis is a meniscus tear. So a meniscus tear in someone high school, college, 20-ish year old, the meniscus is the shock absorber in your knee. So if we look at our knee model here again, this is the meniscus. It's between the femur and the tibia. A tear of the meniscus, if the meniscus is rolls to act as a load sharing. So when you walk and you strike like this, the force dissipated from the femur to the tibia is dissipated by the meniscus. If you have a tear of that meniscus, then the forces won't be dissipated as they would normally, and that may lead to undue stress in your cartilage, which may lead to arthritis down the road. That takes, again, many years, like the ACL tear, before that happens. And the other form of traumatic arthritis would be an injury to the cartilage. So say someone had a twisting injury, their ACL was fine, their meniscus was fine, but they may have taken a piece of cartilage out like that. That can lead to early arthritis too, as the cartilage gets overstressed in the area where the damage was. So what can you do to prevent post-traumatic arthritis depends on what it is. If it's a meniscus tear that can be fixed, fixing the meniscus tear should in most cases lead to a normal knee function with time. An ACL tear that is operated on and reconstructed, especially if there's no meniscus or cartilage damage at the time, can also lead to a good functioning knee. Different treatments are being done for cartilage defects like this, and some of those may also help prevent post-traumatic knee arthritis. Keeping your knee motion good, same as the other side, keeping your strength good and keeping your function good is probably the most paramount and important thing to do to help prevent knee arthritis or prevent it from hurting if you do get it in a post-traumatic knee. Thanks for listening. See ya.